Welcome to PCOS Awareness Month. Hello everyone, welcome back to this YouTube channel. My name is Oreoluwaa with a double A, and you're welcome to this YouTube space where we film about faith, health and lifestyle. Today's video, as you can already tell from the title of the video, is a health-based video. So today we're talking PCOS, and in full it means polycystic ovarian syndrome. So what is PCOS? PCOS is a hormonal imbalance disorder that interferes with the reproductive system of a female, and it is pretty much common. About 1 in 10 women experience PCOS. But the flip side to it is that it is arguably one of the most underdiagnosed issues or diseases in the world. PCOS is not ovarian cyst. They are two different things. You can have ovarian cyst without having PCOS, and you can have PCOS without having ovarian cyst. Ovarian cyst is basically fluid accumulating in your ovaries. So that's just ovarian cyst. But for PCOS, it's a syndrome and it comprises of different things. We follow the Rotterdams Criteria that has 3 major things: irregular periods, number 1, increased level of androgens, number 2, and then number 3, you have ovarian cysts in your ovaries. So those are the 3 things that we check for. But for PCOS, to diagnose PCOS, you either have to have 2 of these 3 things. You don't necessarily have to have the 3. Not everyone has the 3. So to explain this criteria very well, I'm going to be talking about each component. So the first part is increased androgens, and androgens are male hormones. As women, or as females in general, we all have some level of male hormones and we have some level of female hormones. But what happens in PCOS is that the male hormones, which are the androgens, are higher than they should be. Ideally, the female hormones are usually higher than the male hormones for a lady, but in PCOS it's different. They have increased level of androgens. And now the next one we're going to talk about is the polycystic ovaries. Now we understand that before a woman menstruates and have a regular menstrual cycle, the ovaries have to release an egg. They have to burst. That's how we explain it. It bursts and then it releases an egg. But for PCOS, we have tiny follicles. We have tiny cysts that were trying to mature and then release an egg, but they couldn't. They struggled to release an egg, so they just kept on struggling and they stayed there. So you have a lot of follicles that are immature, small follicles over time. So on the ultrasound, you'll be able to see those small ovaries. Meanwhile, for ovarian cysts, you will see maybe just 1 or 2 cysts, and those ones can grow and get big and all of that. But in polycystic ovaries, they're just small. What it means is polycystic, so a lot of cystic follicles in the ovaries. Alright, and because it's difficult for the ovaries to release the egg, we have the third component, which is irregular periods. For some people it is amenorrhea, just like that. Amenorrhea means absence of menstruation, but majorly we have the irregular periods. What I mean by irregular periods are, okay, usually people have their periods after every 28 days, most times after, if it doesn't come at the 28th day, maybe 27 or 29. For people that deal with irregular periods, you can have a period after 21 days in last month, and then this month you have the period after 34 days, then the next month you have the period after. It could go as high as 40 days, it could come as low as 20 or 26 days. Okay, so this is what I mean by irregular periods. Sometimes it can be explained as less than 8 menstrual cycles in a whole year. So when you make a calendar and you do a chart of your menstrual cycle for the whole year, and you're able to count how many times you've seen your period, and it is less than 8 or 9, you should see your doctor, even if that is the only component that you experience amongst all these symptoms that I have mentioned. So because of these increased androgens that I talked about earlier, the male hormones, some people experience physical symptoms such as increased facial hair. So they have hair underneath the chin or sometimes above the upper lip. Some other people experience increased hair production around the chest region. So these are symptoms, physical symptoms to watch out for. Something else that is important to watch out for is obesity. However, PCOS is not restricted to those that are obese alone. There are people who are slim and still experience PCOS. There are people that are of average body weight and they still experience PCOS, but it is just something that you should watch out for. Another important symptom is excessively oily skin and a lot of acne. Those are physical things that you can see for someone that has PCOS. Key symptom that a lot of people experience with PCOS is infertility, and it's at that point when they're trying to conceive and they can't. That is when they begin to check their hormonal level, do scans, and discover that they have PCOS. However, you don't have to wait until you're trying to conceive before you get yourself checked. The reason why infertility is a problem is because you need your eggs to be released, and this is an issue with those that have PCOS. So at the end of the day, they struggle to get pregnant because their eggs are not being released. So why is it important to really know about this condition and know how to actually holistically take care of yourself? Aside the issue of fertility and infertility that I mentioned earlier, another important complication is diabetes mellitus. And I said earlier that PCOS is a hormonal imbalance disorder. So another hormone that is affected is insulin. Insulin is produced in excess and also triggers the androgens, which are the male hormones, to be produced a lot. So this insulin imbalance is something that should be checked as well. Also, another complication that can be developed later in life is endometrial cancer. And we all know that is a whole different topic, but anyways, these are the things that we're trying to avoid. That's why we're creating awareness for PCOS. So how exactly can we manage PCOS? It is not something that you take a medication for and that's it goes for life. No, there's no cure, but there is management, and the management is like lifestyle changes, lifestyle modification. Take for example, which is the first thing that we usually start from, especially for people that are obese. You need to lose weight, and the loss of weight that we're talking here is not just cutting out all your sugars, cutting out all the carbohydrates. No, it's to get a holistic approach, you will need to see a gynecologist first. You need to see a dietitian that will help you know, okay, what's best, what hormones are we struggling with, and how best do we need to manage it. If you're not overweight, that might not be a problem, but if you are overweight, you might need to see a dietitian. Then another important specialist that you might need to see is an endocrinologist. However, a lot of gynecologists and dietitians can put you through the basics of what you need to be able to maintain a healthy life as someone dealing with PCOS. Seeing a gynecologist is very important because a lot of people suffer from unexplained infertility because they are not opening up to talk to a specialist about their condition. You might just be a medication away from, getting pregnant and having the children that you want. A lot of people that I've seen I've had PCOS and I've been able to give birth to as many children as they want to. So please see your doctor. All right, a dietitian is also important to counsel you on the right type of foods you eat instead of cutting out carbohydrates and sugar and working out excessively. For people that suffer with PCOS, you don't need to exercise vigorously. Some people just need small exercise, like just little minimal exercise, and they achieve the stability that their body and the hormones need. Also, resting is important. That's just a side note. I'm just chipping that in. Resting, getting your required amount of sleep for a day is very important to get your body stable. In order not to make this video super long, I'm going to stop here. And if you have any questions, don't forget to drop them down in the comment section. I will definitely answer your questions. Probably I'll make a second video if the questions are so long. And don't forget to share this video with all your friends. If you're a guy, share with your female friends. If you're a lady, share with your lady friends. Share to people that are important to you. All right, and don't forget to give this video a thumbs up. I will see you in my next video. Bye guys.